There should be, I think, more sort of senior leaders who are out there talking to consumers about what's being done and maybe why
Doc,
it's
you
not.
know what? You take the lead. No one else wants to put the time into it. They had such a good thing for so many years. They were making so much money for so many years. They always kept the information so close to the vest because they didn't want people to know the reality of the surgery, because they felt it would scare people away. Now it's necessary that consumers know this. Otherwise, you're going to be really damaged out there. How
Hey,
are you,
Spencer,
man?
how are you?
Well, I can't complain, man. How are you?
Good. Thank you so much for joining me. It's kind of surreal, seeing you on the web and then now you're here with me. So I really appreciate you stopping by.
Hi, it's my pleasure, man. Thanks for inviting me.
Definitely. Yeah. I mean, I think you're one of the most influential consumer advocates in the hair transplantation community.
Well, I'm
Yeah.
certainly the oldest, so
Well, that's part of it, being around for long enough to see things kind of progress and change over time. Is definitely, something that's important for us, younger people to kind of look up to. So
absolutely.
just to kind of get things going, like what got you interested in hair restoration?
Well, I've been losing my hair since I was 21. I noticed it right after college.
Yeah.
It was traumatic, and obviously, you deal with a different type of hair loss. How old are you,
Sure.
by the way?
I'm 35.
Okay. So, you deal with a lot of young guys, I'm sure, who are dealing with common androgenetic alopecia. But when it hits you at a
Yeah.
relatively young age, it really impacts your life in a way that people who aren't losing their hair could never fully imagine. So
Right.
to cut to the chase, I started to do my research. Everyone back in the day wanted to sell me lotions and potions. I tried everything. There were guys who wanted to perform hair transplant surgery on me, and there was really nowhere to transplant the hair. So I kind of felt something was wrong. So I stepped back, and I was lucky enough to, I guess, have the wherewithal to step back and say,
Yeah.
you know what? What's happening here? This is really odd. So I did
Right.
my due diligence, did my research. I found the drug Finasteride, which
Okay.
I believe changed my life. Then I decided to write about my experiences. That's how it all
Interesting.
started.
That's great. And then the effects of finasteride, like how quickly did you see the change to your hair?
I was an early responder. So I would
Okay.
say that this is atypical. I started to notice a cessation of hair loss and regrowth within about I saw a cessation within 3 months, and I saw significant regrowth within 6 months.
That's great.
So you have to understand, this is back in 1994. I was using Proscar. It was just approved for benign prostate hyperplasia or enlarged
Yeah.
prostate. And I read an article in the New York Times about it potentially being tested for hair loss, because one of the side effects was these guys were they were growing hair who were on
Yeah.
this and these were older men. I found a doctor willing to prescribe it, and I guess the rest is history.
Yeah, that was pretty early on for sure. Yeah, minoxidil had a similar kind of course in that it was used, as like more of an IV injectable for ICU patients. And then people were noticing that, hey, for like blood pressure management, and they were
Yeah.
noticing people were growing their hair. So now there's actually been a move back in some ways to oral minoxidil from the topical.
I have to tell you, we get more questions through the American Hair Loss Association and through my broadcast about oral minoxidil than we have in the last 23 years. And I don't know if you're aware of the Global Hair Loss Summit that we put on in December, but
Mm,
there was a talk from a Spanish physician
yeah.
who has been prescribing oral minoxidil to his patients. After that summit, I would say at least 70% of the members in the IAHRS are now prescribing low-dose oral minoxidil as an adjunct to finasteride, or to those who either had adverse side effects or were concerned about taking it.
Yeah, yeah, it's a nice option. I'm starting to prescribe that myself. It was prescribed to me. So my background, how I got into hair, just really quick, is that
Yeah.
we're each other for the first time, and I started with Jeff Epstein as kind of his remote arm in New York, and whenever he'd come to New York, I'd join him, and slowly kind of growing my practice and just increasing my skills and
What year was that? When did you start?
this was in 2018, so pretty recently. And then we were together for almost 2 years, and then or like a year and a half, and I kind of branched off, and I was running my own facial plastics practice, and then I kind of pulled hair.
I mean,
Yeah,
how was working with Jeff?
you know, I
Slave driver?
he was a great mentor. But at times, I wasn't necessarily like a colleague. It was more like, kind of a apprenticeship where he was sort of the head guy and I was just the student. And that's kind of how it felt. So, there were some limitations, to kind of how open it could be in that relationship, because you feel like you're there with your boss, as opposed to just the colleague. So, at the end, once we kind of split up, we're still, very friendly. And he's like, you call me Jeff now, because I was calling him Dr. So, yeah, there was a little bit of that just because.
Yeah,
again,
I was going to actually ask you to call me Mr. Kobren, but I'm just kidding.
The opposite. Yeah, no,
Yeah.
so, I learned a ton, obviously, and spent a lot of time with him. And whenever I'd go to Miami, I'd stay at his guest house. So it was an invaluable experience. And I think it's very hard. So this is kind of a different topic, but I was just going to say it's very hard to learn hair well, and so
it's almost impossible, really.
Yeah, that's one of the big limitations, I think, because there's no like concrete track. A lot of people who end up doing these fellowships through the
ISHRS, yeah,
a lot of them anyway, they don't have like their residency that they finished, and they're not on a specific track. They took a little bit of a detour, let's say, and then
let me be more candid. You're being really diplomatic. I think it's important for your viewers and listeners to know this.
Yeah.
Most of the guys hanging up a shingle claiming to be hair transplant specialists or experts are just hanging up a shingle. They're either buying a turnkey device, they've maybe taken a course or a weekend course, they may have gone to a workshop and paid for this workshop. There is no true pre-ternships or internships. Only a handful of surgeons worldwide really have the time on tissue to actually perform this surgery. And it's being promoted now more than ever as a commodity, when this is one of the most difficult and elegant and nuanced cosmetic surgeries, and you're a plastic surgeon, that there is, because people don't realize that it's a team effort. Every step of the process dictates the end result. If you happen to have a technician that day or an RN or whoever's working with you that day that is not feeling great, that's not implanting well, that is just not into the game, your transplant is done.
Well, you also have to be able to jump in and do the job, so that's the other thing. There's so much to talk about. But just to take a step back, so what I was going to say was that with Jeff, when I started with him, I had a full head of hair. If you go and look at my website, you'll see me with, a lot of hair. And that's
I checked you out before I decided to do this. I wanted to make sure that I was speaking to someone who I felt comfortable with. So yeah, I mean, I've seen what you've been through.
Yeah. So my story. And so I didn't get into, hair transplantation for that reason. I had alopecia areata on my legs since I was in med school for like 10 years now, and it never really bothered me. I didn't really care. They offered me steroid injections. I'm like, it's on my legs, who cares? And then over time, progressed up to my arms, and then I had a spot at the end of fellowship right before I started with Jeff. There was like a spot out here, and I remember Jeff was injecting me with steroid, and and that eventually came back. And then I had another little episode where the brow started to thin, and I started kind of thin on the temple area. That also came back. And then I'm pretty sure, this is kind of interesting actually, because I'm pretty sure I had COVID back in January of 2020, and at the tail end of that, when I was feeling better finally, because it was this mysterious thing going around in New York City, all the urgent cares, like, everyone's getting sick with something, we don't know what it is. I was flu negative. It was definitely that, really high fevers, like over a week, whatever. So then that got better. I developed Bell's palsy, knocked out the right side of my face. And then as that was improving 3 weeks later, I just started to shed nothing was going to help. I tried PRP, nothing was helping. It was just a mess. And then it kind of like just all went away. And then now it's starting to show some signs of a very, very early return. And I'll show you. This is what it looks like now. So it's the baby hairs, and it's kind of strange looking, but I'm not shaving it. I'm just kind of seeing what happens.
I just want to tell you that another reason why I admire you is you didn't stop. You didn't allow this to stop.
Right.
You continued. You were face forward on camera. You shared your experience with everyone. In my case, kind of being the first guy, and I was young when I started, talking about male pattern hair loss and how it affects our, how it could potentially erode our self-esteem as our hairline erodes, and just how it affects our lives. That wasn't the sexiest thing in the world to do. Trust me. Initially, even in the press, I got a lot of crap. It was looked at as I was almost, overly vain. And what is this guy talking about? Why is he comparing it to a disease? Because I stated clearly in my books, and also in most of the articles that I was in initially, that hair loss is kind of a cancer of the spirit. And it affects people who deal with it in ways that those who don't can never even imagine.
Well,
so what you've been dealing with is profound. And especially, like you said, you knew that you you had alopecia areata, but you had no clue. You never know where it's going to go. You don't know if it's going to turn into universalis.
Right.
And I think you have a really important story to tell.
Yeah, I mean it's really interesting to me because I just chose the field because I took Jeff's course as a fellow, and I'm like, this is really cool. I didn't know much about hair before that. It was on our exams, and for ENT, and most of us would get those questions wrong. Just read the same chapter in the same textbook. Never were exposed to anything related to hair transplants. And then in fellowship, they told me, oh, you can go to Miami and take his course if you want. There are a few other options. I'm like, oh, I want to try that. And I just thought it was really cool and very meticulous. I'm kind of that's why I picked kind of head and neck anatomy and facial plastics to begin with, because I was always drawn to kind of like more tedious tasks that were more kind of fine rather than, bigger surgeries. Even in head and neck, there are big wide open neck dissections that, I did in fellowship and residency, but I didn't really want to do that in practice. It just, wasn't me. So I love the kind of more fine kind of work. So I got the exposure there, and then we kept in touch. I'm like, I'm going to starting a practice in Manhattan when I finish fellowship. And he's like, yeah, if you want to work with me just part-time, let me know. And then it just kind of developed into this really great, like almost like an apprenticeship, but I was operating on my patients. And then
now let me ask you, so what were the cases like initially? I mean, were they patients that were drawn in through Jeff, or were they your own patients?
They found Jeff first, and then, well, this is the true story. So if
let's hear it.
They weren't willing to pay his rates, they would come to me. I mean, generally speaking, and I would work with his technicians. And I mean, I spent a lot of time in Miami, and then when he was in New York, just, shadowing, being a first assist for him for everything from hairline lowering surgery to actual transplants. He would throw me in with his team, let Gary work for an hour here or there. So eventually I felt very comfortable with all the different steps of the procedure. Yeah, so then when it came time to actually doing my own cases, it wasn't like, oh my God, I was like, all right. And it was with his tech. So I'm like, okay, like they know what they're doing. I know what I'm doing. Like things took a little longer, but like we got through it.
I think this is a really important story because now you have time on tissue. Now you're a skilled hair transplant surgeon. I'm not saying that you didn't have the hands, when you started, but the reality is most consumers have no clue that, wait a second, if I'm going to pay less for an associate, this associate may only have one case under his belt, and I think it's really important that you shared that because most consumers have no clue that that's a possibility.
Yeah, no, you're absolutely right. And the skill set is very different. I remember Jeff making fun of me. He's like, you're going too slow with the extractions. Like, look at the text. Like, they were going 5 times, 6 times as fast as I was. And I'm like, I mean, I know how to suture and I know how to dissect tissue, but this is different. Like, there's a different instrument in my hand. And
now, were the techs that you're using, were they technicians? Were they RNs? Were they nurse practitioners?
So his techs have been with him for a long, long time, and most of them are just techs, like maybe MAs. Yeah. He does have nurse practitioners who are also technicians and do other within the practice.
I just want to make it clear that the ISHRS is really anti-tech being involved in the surgical aspects of things, but I see things differently. If it's legal in your state, if these technicians have the time on tissue, a lot of times they are better extractors than physicians. So the team is really important. So for any organization to say only surgeons should perform surgery as far as this particular surgery, I think they're doing patients a real disservice because the majority of real great extractors, at least in this game, they're not doctors.
Yeah.
That's a skill set that most guys don't want to learn.
Yeah, it took many, a few dozen cases until I had the speed of like a good, extractor. And now it's really nice because and Jeff always emphasized this, and I'm thankful to him for it because he always said, like, don't just rely on the techs to do the extraction, especially
absolutely
for my team. Like, you have to do this yourself. And it took time, and you can't just the case can't take all day. So you need to.
Well, Jeff is essentially a founding member of the IHRS. He came on board about a year after I founded it, it just turned 20, which is insane. Jeff was really, he was really involved, especially at the beginning. He's been doing this for a really long time, so there's no doubt that he knows how to train his techs.
Yeah,
and because he's the guy who had the hands on tissue and the time on tissue for so long. Yeah. So I think you're lucky that you found him.
Yeah, no, it was really kind of amazing how everything worked out because my uncle in Manhattan was starting his own space. He's a chiropractor, but he started his own, just kind of like a wellness space, and with a couple of different providers under one roof. And that's when Jeff was looking for a different home in New York City. And that's around the time when I joined him. So everything sort of worked out really great, because then he was operating out of this new space where I was normally. And so it was just whenever he would come to town, I stopped everything that I was doing and I would just be with him and his team. And when he was there, then he would feed me patients, and then also, I would find my own. So, and then ultimately, he's not really coming much to New York anymore, at least definitely not operating. And with COVID hitting, and that was the decision before COVID, right before COVID.
I also think he has a young kid now, and he's kind of like slowing down. And
yeah, and now with travel, like he always said this, like now, people love to go to Miami. Before it was like hard to kind of necessarily get them there, but now it's so easy to just hop on a plane and go somewhere for the day, get the procedure, and then go home. So people
I think here's the good news for New Yorkers. There's a handful, sadly, but they're still really good, of really great surgeons in New York tri-state area. Not easy to find, that's part of why we have the IHRS, but you're somebody that I took a close look at. And again, you've been doing this for a while. You had a really good pre-ternship or internship with Jeff. Just the way that you kind of express yourself online, I can see that you really care for patients. Look, I have a tendency to kind of take over any conversation I have because I've been doing this for so long. So I apologize if I'm doing it.
No, don't apologize.
But I like speaking to young physicians who are kind of getting to this game when it's so dangerous. It's so much more difficult for consumers to navigate and to find really good surgeons because they're bombarded with, we're on Instagram right now.
Yeah.
Whoever watches this, they're going to go to their feed and they're going to see ads for 10 other doctors. And they're going to price comparison. They're not going to know where to go and what to do because it's been sold as a commodity for so many years. And it's not.
The other hat that I wear with the facial plastics work, I teach a course for injectables and non-surgical things. And of course I do surgeries as well. But the closest that I can kind of equate this to, because for facial plastic surgery, there really aren't too many people who have no proper training and took a weekend course for doing rhinoplasty. It just doesn't really happen. You have people who shouldn't be doing rhinoplasty doing them, but not to the same extent. But the closest analogy would be filler. People doing Botox and filler, and you just have so many poorly trained people who have no proper background, don't understand the underlying anatomy of the face. Whether they're doctors or nurses, it doesn't matter. It doesn't matter what degree they have.
But that's another thing that people are not aware of. Consumers think that, well, just filler, what can go wrong? Well, you know what? Your entire face could your skin, you've got necrosis at the side of your face.
Yeah, blind.
You can lose a chunk of your face. You can go blind.
Yeah.
And again, the way that these non-invasive procedures are being performed to me, being promoted to me, it's criminal. Yeah, in the right hands, it could be it's relatively, non-invasive, and you can get really good results. But you have to be really skilled. Yeah, so you're right about that. That's a good comparison.
Echelon, above these injectables, and yet it's being done, like you said, by people who've taken a weekend course and think that they have the know-how to proceed. And there's the technical side of it, but there's also just understanding what to do for what patient and just taking a step back and saying, could this be a different hair loss condition that I have to think about? So there's just so much knowledge that needs to be acquired beyond just the technicality of moving some hair around.
Well, I can tell you that, there's a lot of reasons for this, but one reason is the larger organizations don't want to admit it, but they lost control because they wanted to kind of keep the reality of hair transplant surgery close to their vest, because if they sold it as a real surgery, as something that took a heavy skill set initially, then it wouldn't have been so easy to sell. The old school guys like Bosley, for instance, you would see the infomercials and the commercials of the hair flying from the back of the scalp onto the front, magically having a full head of hair, and they would sell it as a simple outpatient procedure like you were going to get your teeth filled, when in fact that's not the case. So they got themselves in trouble years ago. And then as the barrier to entry got less and people can just pick up a turnkey device and a machine and then go on an app and get some technicians to come into their office.
Right. SmartGraft and NeoGraft.
Yeah. Consumers. Well, SmartGraft doesn't do that. NeoGraft does. SmartGraft is the one thing I like about SmartGraft, as far as if you're going to get involved with any device manufacturer, is they don't have their hands in the doctor's pockets and they do not promote technicians. So they kind of they want their device out there, but they want the doctor who has it to have some training, and
Hmm.
they don't provide them with access to technicians and stuff like that. So it's different. But yeah, you don't need to get any of these devices to learn. Really all you need is a punch. They're different size punches.
Yeah, and I mean there isn't enough out there about like what the best punches are. Like what we talk about at the ISHRS with the Y and the Trevelini being the most kind of dominant, in sort of proper hair clinics or practices. I mean that's not something you see widely advertised. I mean those aren't the companies that are putting out all the big ads and all of that. So people don't necessarily even know, what these devices are, yet they're technically the most advanced and they leave the least amount of scar,
Well, currently they're the most used by real hair transplant surgeons. But the reality is, and I'm not a physician, but I've been doing this for a very long time, is there are guys out there who are still doing it by hand, and they're using either their own types of punches or just even punches off the rack that are .08s or .09s, and they're able to get incredibly beautiful grafts. But it just takes time and it takes effort. The WA system and these other systems, they just happen to be the most heavily promoted through the ISHRS, but they're good systems
Yeah, yeah,
as
they're good.
well.
What are your
Yeah.
thoughts on the robot? I mean, I put out a video on some of my thoughts, but where do you stand on this artist? And
Well, to give full disclosure, I worked as a consultant for Restoration Robotics for 2 years to try, in my view, to try to get them on track
okay,
as far as moving in the right direction. While I was working in a consulting capacity, I did convince them to start to utilize smaller needles or punches.
that's good.
So, and that made a significant difference. And it was my suggestion, which they ended up
Mhm.
taking, to create a smaller footprint, separate the chair from the device, and also to offer a handheld device along with the robot in case there was issues. The reality is you can only do so much work and get so many grafts out with that robot.
Right.
And in most
Like,
cases, all the stars have to be aligned for it to really work well. And end user or the person that's using it has to understand how to set those parameters perfectly. So
yeah.
with that said, ended up separating from the company. But the entire time, my mantra was, I will not sell a robot, and I will not tell my listeners that I would lay down for a robot. All I'm going to do is try to get you to where you need to go so this thing can get better. This is what I can say. I would say
Mhm.
that the majority of robots that have been sold, in my view, are being sold to physicians and clinics that may not have enough time on tissue to use the technology
Yeah.
properly. I don't think there's anything necessarily wrong with the technology, but I don't see any advantage to the patient if the practitioner doesn't know how to use it.
Yeah. There's I won't say the name obviously. There's another hair transplant surgeon in town who recently purchased a robot and was so unhappy with the size of, the holes in the back that decided to sell it, right? Well, to wherever he's going to sell it to, but he's not using it anymore. And this was just in his office for a few months. And I don't know. I think that's kind of telling because I think if you really do the comparison and you're able to see the side by side and you have one system that gets you great graphs or even the manual and leaves minimal kind of footprint in the back and another one that's leaving you with sizable scars, I don't know how
Well,
someone can.
here, listen, I've been here from the beginning. And when the robot first came on the scene through the American Hair Loss Association and my program, I would just let consumers know, in my view, it wasn't ready for prime time.
Yeah.
It took many, many years before I was willing to actually take the opportunity to consult with them because I thought that maybe we can improve things. And we did. I mean,
Mm.
tremendously. Things have changed a lot. But with that said, it's completely user dependent. And even the larger graphs, here's the thing. Initially, when the robot is set up, it's usually set up by technicians who used the largest needle or punch so that
Yeah.
things can be easy. So they're not necessarily looking at the patient saying, okay, it looks like we're going to be able to get really nice graphs out using a .8 or a .09 or whatever it is. They're
Yeah.
just still in the regular punch. So that's why this guy was seeing larger holes. It is possible to get really good grafts and to have smaller punctate wounds with the robot, but most people, at least in my view that I've known, don't really
Okay.
know how to use it. Only a handful of guys. Ken Anderson in Atlanta, he knows how to use it. Bob Bernstein in New York knows how to use it, but he doesn't just use it exclusively. There's some guys who know how to use it, but
Yeah.
in my view, it's only a handful. The
Yeah.
technology itself is really cool, and I think that this surgery lends itself to robotics. But in general, like I said, most guys who have their hands on it aren't using it properly.
Yeah, no, I mean, I think it's great that it exists. I just think that maybe it's not quite ready for prime time for most people. Like you said, like there are some maybe super users out there, but it's a lot of people think that's how they're going to start their practice. As long as they get the robot, everything else falls into place. And it's
Well,
going to be
I actually spoke. I spoke at a conference for the robot, and I was asked by, I think, someone who worked for the company. Essentially, the question was, would I have robotic surgery, and then it was like you would definitely have FUE over FUT. And I was very, I point blanked them, and I said, or I was very honest, and I said, look, for me, being my age, and at the time I think I was 50, I said, I've avoided hair transplant surgery this entire time using medication. If I chose to have hair transplant surgery because of the way I wear my hair, I would
Mhm.
certainly go for strip because,
Right.
in my view, I can get the most vital and the best possible grafts out of the sweet spot and use
Right.
100% of those grafts to move to where I needed it. And because I wear my hair longer, it would be fine for me. And I said, I'm not sure if I had FUE, if I would go for the robot right now. And I said that, I was very honest. People were silent. They didn't know how to deal with that because I was speaking at this conference. But
Yeah.
that's the truth. If you know who you're going to, and if you could see that that physician is getting great results using the robot, then sure, have a
Yeah.
robotic
Sure.
surgery with that doctor. But to sell it
Right.
as state of the art, this and that, any device, whatever device a clinic is using is only as good as the person that's wielding that device.
Yeah.
And that's
That
important for
that
patients to know.
There, yeah, no, you're right. And, I think hospitals did this with the Da Vinci robot before really anyone knew its exact benefits and advantages for different types of surgery, including, prostate surgery and whatever else. Now it's used for just about everything. But before anyone knew like its true advantages, they were just selling it and using it as like a marketing ploy, and it's like, I have 5 robots. How many robots does your hospital have? And it was just a way to kind of one up and
Yeah, but
get.
you know that the main marketing guy for Da Vinci at the time, who ended up working for Restoration Robotics as I think he was hired as CEO. There was some lawsuits against the company, and this guy admitted in court that the Da Vinci was sold to physicians who were not skilled in laparoscopic surgery.
Hmm.
So they were essentially admitting that they were going for the low-hanging fruit.
Yeah.
And that, I think that speaks volumes of. So when people think of robotic surgery, it's sexy. It really is. Like, I
I
get
know.
it. You think it's going to be an exact science. You think it's going to be much more exact.
Right.
And the reality is, I'd rather have someone take some cold hard steel who knows what they're doing
Yeah.
to my
Well,
body. Go ahead.
yeah, I mean, someone like Bernstein is like a kind of a pioneer in the field, and like you could be a person like him who says like, well, I want to, now pioneer this whole robotic
Yeah, yeah,
and go that route, right? Someone who really knows what he's doing. But then, like most other people who really know what they're doing, if something's working well in their hands, they're not going to just switch over to the latest, greatest thing that's also a million times more expensive. Like it just doesn't make sense unless you feel like compelled to because of the marketing sort of pressures,
well,
But
that's what as the industry has, I should say, devolved, and as more people have gotten into the industry, some of the old timers, even the really guys with great skill sets,
mhm,
have jumped in that direction because purely for the marketing aspects of things.
yeah,
And for most of these guys, it backfired. A few of them, it worked out well. And like I said, you got a guy like Bob, or you got Scott Alexander
hmm
in Arizona. But these guys have unique skill sets. They know what they're doing. They can make that robot work. So they can leverage that marketing, but they also know what they're doing. So the patient's going to be in good hands.
right. Yeah, that makes sense. Yeah.
But that's rare.
And for me, it may be just, because of who I trained with and things that he, uses, and that's probably like the biggest influence on me. But also, like, I'm always looking at it from the perspective of what's best for the patient, not what's necessarily best for my practice. And I think if you do it that way and you say, like, well, okay, what works well in my hands? What are the limitations of some of the technologies that exist out there? Just be honest with people. I mean, if someone has mastered the robot, great, go out there and talk about it and show your results. And like you said, it just doesn't work for most people, and it's just not really necessary, even, because then that brings up the
It
cost.
it
Buy a robot for three.
it is not it isn't necessary. And the reality is, with all these things, if a physician has to pay a company, is attached to any company, then that cost is going to be translated to the patient, or they're going to have to cut corners in other ways to make it more affordable for the patient. Either way, it's not a great idea unless all that information is provided to the patient ahead of time. This is why it's going to cost you more money, because it costs me more money. But patients aren't aware of that. Because of competition, when these guys make these heavy investments, sometimes they have to cut corners in other ways. And again, this has nothing to do with the technology. This has nothing to do with the company itself. I'm not saying that it's not great technology, because I was compelled from the very beginning to learn more about it, because I do think that this surgery, I'm going to repeat myself, lends itself to robotics.
Yeah.
But right now, it is not necessary. Maybe one day it will be.
Yeah, I think one day it'll be super helpful and useful, especially once, we have cloning and you just have as many grafts as you need, and it's super labor intensive. The pool of great technicians is also quite small, and that's something that I've learned in New York City, where we have some talent, but it's very, very small.
That's another huge con in this industry. It's so sad that consumers have no clue. They just walk in there and they'll go on your credentials, and they have no idea that someone who just flew in from Tallahassee and got drunk the night before is performing surgery on them that morning, because they're just looking at the doctor's credentials. They don't realize who's performing a lot of the surgery, and these are the technicians. Right. That's why I think it's important for a guy like you to say, look, these are the people I work with, or I have a full-time staff, and let your patients know. Yeah, I'm sure you do.
I'm lucky with, the way my setup is, where, I'm a kind of younger practice, so I don't have the funds to have like all these people on full time, but we have some good talent in the area. So for my surgical techs, whether I'm doing, a facelift, a rhinoplasty, or a hair transplant, I get to work with excellent techs who are kind of like, they freelance in a way. But I think unless you know what you're doing, and unless you're kind of ingrained in, kind of the right pool of people, you won't have great folks, by your side.
If you're sharing techs with other really great practices, then, and these guys have a lot of experience, then that's fine. The thing about, a lot of doctors don't want you to poach their techs. So there's a whole thing where techs are the really good techs are kind of kept undercover. Honestly, people who are watching, this is a really effed up industry, but the entire cosmetic surgery field is a mess.
Problems with it. Yeah. No. Like one of my techs was with, the Unger team for 15 years, and then with COVID, decided to go on his own because he saw, the potential, he saw whatever opportunity. And and now like he prioritizes my cases, and whenever I have a case, he's with me, and he's incredible. And there are other people kind of from a similar sort of pool. So but I'm just saying that the more experience you have as a surgeon, the better you can pick your technicians, whether they're full-time or with you or not.
100%.
But if you don't know what you're doing, then you're going to just assume that just because someone writes on a resume that they're a tech for X number of years, that they're good. But that couldn't be further from the truth for everyone who writes they're a tech.
And that's actually a really good point, and it also speaks to the reality that so many doctors, even in New York City or Los Angeles, right here in Beverly Hills, they have no clue what they're doing when it comes. They're just buying a machine, hanging up a shingle, and hiring technicians and hoping for the best. I've known guys who've destroyed their practices, guys who have had a 20-year track record with no really bad reviews, and they do one bad hair transplant, and their careers, they're in a panic. So for the doctors who are watching, if you want to get into this field, really learn and know what you're doing. You're dealing with people's lives here. People think it's just hair, but you have a bad hair transplant, you F somebody up, that destroys their life.
And because we don't have the option of cloning at this point, you don't have too many tries. It's not like, especially with FUE, you can't just keep trying over and over. I do, because of Jeff, the body hair stuff, but it's never as good. It's just never, like, the regrowth rate is not as high. Yes, you can do neck, we can do chest, whatever, but your best bet, and the same goes for really any surgery, especially rhinoplasty, actually, your first chance is your best chance to kind of get it right. And with hair, you can, of course, separate it out into different sessions over many years. But, assuming you do like the first session, in a kind of a, bigger way, like if you screw that up completely, like it's a huge problem.
These guys are selling 4,000, 5,000 grafts overseas, whatever it is. You screw up 4,000 grafts, you're done. That's a finite amount of tissue and hair that could be moved. You can't repair that. These guys' lives are, maybe you can make them look normal. Maybe you can remove some of the grafts and recycle them and cut them into smaller grafts and make the person look a little bit more normal. But he will never, or she will never, be the same and never have a completely normal life. And
Right.
I'm going to make this clear because I think my phone is probably dying, so I don't know how long I have. But I will tell you that a lot of women think they could jump into the chair. You know, hair transplant surgery is being marketed to women more than ever. I don't know if you agree with me, but you know, most women with androgenetic alopecia do not make great candidates for hair transplant surgery. They do not have the same type of donor hair. They have diffuse thinning,
I agree.
miniaturization all around their scalps. And I'm glad that you agree, but so many doctors will say, well, I can give them hair for a few years and they're happy. That's not the way to think.
Right. No, a few years is not what you're trying to gain here with hair. No, I agree with you. I think, you know, after a certain number of years, you know, just like with men, I mean, some female pattern hair loss will stabilize and, you know, they may become a candidate. But I agree, especially early on, you know, there's some really young women with severe parting. And yeah, I mean, they're
You know, there's a great website and resource here on Instagram, Women's Hair Loss Project.
okay.
And if you want people to understand the reality of women dealing with hair loss, that is the place to go. And the person that started this has gone through everything and talked about all the trials and tribulations and came through the other side, being able to live a decent life. But a lot of the people on that side and a lot of people that contact this person through Instagram, they've had transplant, they've been sold everything. And frankly, these are young women in their 20s. Their lives are destroyed. Yeah. And by some really famous, well-known physicians who are plastering themselves all over Instagram. So, you know, while I have this opportunity to be with you, I want your listeners and your viewers to know you got to be careful out there. I know that's the message that you put out there as well.
Right. No, absolutely. And then again, we went through so much and it was awesome. But yeah, like kind of the effect of social media on consumer behavior in plastic surgery in general, but specifically hair, you know, a lot of people gravitate to, you know, the accounts with just the greatest number of followers because they just assume, oh, that must be the best surgeon. And they'll just do whatever's on that, you know, on that page when they call the practice, whatever they're offered, they'll do it.
All I can tell your viewers is that if you are making a choice to have surgery based on an Instagram account or based on, you know, a price or based on someone's popularity on social media, you're an idiot. This surgery has the capacity to change your life for the better, but if it's slightly off, your life will never be the same. It is that difficult. It's not like, you know, if you have a bad boob job, you can hide them for a while until you get them fixed. This is front and center. This is the first thing that people see. So if you decide to have, like a lot of women are having their eyebrows done, I see some of the worst in New York, some of the worst eyebrow transplants I've ever seen come out of your city. Yeah. You know? So people really have to do their due diligence.
Yeah, no, again, luckily, you know, training with Jeff, I mean, that's a procedure that he's really, really good at.
He's one of the masters.
Yes. Sure. You know, I picked up a lot of skills there, but yeah, it's easy to just not put enough hairs. It's easy to get the direction wrong, to get the curl wrong, to get the shape wrong. I mean, there's just so much room for error there with the eyebrows. So yeah, no, it's interesting. There's so much that is encompassed within, you know, hair transplantation. And I also wish that there were like younger people like me who are as enthusiastic about the field. Like there really aren't many. I did one of these podcasts with Shaver, who I think, you know, she works with Bernstein, and she's, you know, and she's really in it for the right reasons and very dedicated, and that was awesome, you know, just kind of
we recently brought her on about 3 years ago onto the IHS, and she actually gave a talk for the Global Hair Loss Summit on transgender hair transplant surgery. And I have to say that she not only presents really well, I mean, she's good. She has really great hands. She really cares about what she's doing. She has a conservative approach, kind of like Bob Bernstein. My goal is, you know, I got into this so young that while I'm still young enough to see the changing of the guards.
Yeah.
And my goal is to, now that things are a mess, to kind of like provide consumers with access to the new leaders of this field, and also help consumers to separate all the hope and the hype and all the nonsense, you know, from the reality of what they can have. Hair transplant surgery is an incredible surgery if it's done right. Sadly, we see so much bad surgery these days. People still have that stigma that hair transplant surgery looks pluggy. You know, it doesn't have to be that way.
And I almost feel like it's kind of sad that, it takes someone like me who's just, kind of a few years out and just trying to do the right thing to get out there and like talk about it. There should be, I think, more sort of senior leaders who, are out there talking to consumers about some of what's being done and maybe why
Doc,
it's
you
not.
know what? You take the lead. No one else wants to put the time into it. They had such a good thing for so many years. They were making so much money for so many years. They didn't necessarily understand what they needed to do. They don't know how to grind. They don't know how to get the information out there. And they always kept the information so close to the vest because they didn't want people to know the reality of the surgery, because they felt it would scare people away. Now it's necessary that consumers know this. Otherwise, you're going to be really damaged out there.
Yeah.
So I'm glad you're doing what you're doing.
I appreciate that, Spencer. Yeah, and to do this surgery well, I have a buddy in Alabama who's asking me recently, like, oh, like, what if I want to get into hair? He's a oral surgeon, but trained in some cosmetic surgery, so he does a couple of other things. He never really did any hair, and he was like, just tell me like the truth. Do you think I can like figure it out? And I'm like, I wanted to be as nice as possible, and he has good hands, but I'm like, this is going to take a long time if you're serious about it. It's a lot of people add it as kind of just an additional revenue stream rather than
It's put on their menu. If any of these companies that are trying to sell you a device, that's what they're saying. They're telling you how much money you can make. Consumers don't know that you can put a machine in your back room, hire technicians, and a doctor can make an extra $10,000 bill every day for doing nothing. And that's how it's sold.
Yeah, and it's the wrong approach, and it's not a sustainable solution. I mean, I'm amazed at some of these places how they can keep that going. I guess the work is good enough, and they just kind of sustain some sort of hair practice.
It's getting more difficult, but if you look at the old school guys like Bosley, for instance, who have come a long way. But initially, the work wasn't that great. A lot of damaged people out there, but they put enough advertising. There's 200,000 of us waking up every day realizing for the first time that we're losing our hair. So that's the first time they're taking a look into these things. So they don't know the history. They don't know that it's possible to be effed up from the surgery. So they just keep plugging away, no pun intended, and they're able to survive because hair loss sufferers are so vulnerable. They will buy anything, try anything, subscribe to anything just for hope. So it's evergreen.
What are your thoughts on people traveling to, say, Turkey for cheaper surgery? Because, I mean, I don't know too much about it. I just know that there are some good clinics, but then a lot of people come back and they're kind of messed up.
We have a handful of clinics who are associated with the IAHRS, but we have, and this is not hyperbole, we have applications from Turkey and India every day. They are with checks in hand. They want to be a part of the organization. We have turned down hundreds of applications. I think we have 4 in Turkey, or 3 or 4 doctors in Turkey. Listen, if you're willing to travel and you go to a real hair transplant surgeon in Turkey, you're going to have a good outcome and you're going to save some money. But these guys can only perform so many surgeries. What normally happens is, they're jockeying for position with these guys who are willing to provide a surgery for, 1,200 euros or $1,500 with expenses paid. And real hair transplant surgeons in Turkey, even though it's less expensive, it's still going to cost a few $1,000s minimum for a relatively small procedure. It's going to cost, 5,000 US. So if someone is going to travel, the truth is either come to the American Hair Loss Association or the IHRS, or you can see who you're going to by price. Anyone in India or Turkey is going to charge a relatively significantly more expensive price than their local competitor if they're good.
Interesting. Yeah. So that's a really good point. Something for people to look out for. Great. Anything else, Spencer, that you want to add for my listeners, or just anything in particular you're excited about? I know we talked a lot about the cons and, things that we'd like to see, maybe improve, but anything that you're kind of truly excited for that's on the horizon? Or
I'm excited for, this is not to sound promotional because we don't sell anything. This is all educational. But, Global Hair Loss Summit is, we had such a successful event in December that we're making an ongoing educational resource for physicians. So for the first time, guys like yourself, when you first started, like you said, it was hard to find a way to learn. We're going to be providing access to physicians who want to get into this game to actually learn how to do it the right way. So I'm excited about that. Now, with that said, there's only going to be a handful of guys, maybe a few hundred guys willing to take these courses. But consumers are going to know that at least they have the time on tissue, I keep repeating that, and the education to be in the specialty. As far as what's happening for hair loss sufferers, that's really exciting. Not much has changed in the last 20 years when it comes to medication or treatment. It's important that your listeners know, your viewers know, that not all PRP is created equal.
Right.
A lot of it is a con They, even doctors don't know what they're re-injecting into your scalp. So go with somebody who is truly a hair loss specialist like yourself, and don't go to a dentist to get PRP.
Right. And then you have some doctors who are trying to be clever and they're trying to make their own PRP tubes so that it's even cheaper. And, again, not based on any science or anything like that. I mean, I personally use the M-Site system. I think there's, they have the best research. Peter Everts is just a good scientist in that company. And I actually did a study on needleless PRP, which is under review now with a machine called the Jet Peel. And it's kind of interesting. So one of the founders of that company was a patient of Jeff's. He was an eyebrow transplant patient. And he was in our kind of general office space. We're doing the transplant. He's like getting the PRP, for his procedure. And he mentions this machine that can kind of do transdermal delivery. And it's been used for like 10 years for other applications. Wound cleaning, like for in aesthetics, like for facials. So it's not like a brand new technology. But the handpiece that they came up with for PRP with this kind of shield technology to keep everything in rather than dispersing this product all over the room, that was novel. So he told us about it, and I'm like, Jeff, this is interesting. I don't know. What do you think of this? Should we try it? He's like, yeah, maybe do a study with them. So that was the beginning of it, and I had a small pilot study of 14 patients, all with male or female pattern hair loss, and it was kind of amazing that it really did work. I mean, we did like 3 treatments, 1 month apart, just like all the other PRP studies are organized. And I did global photography and then different survey kind of questions to figure out, what the change was, and extremely high satisfaction rates, 0 pain. I mean, there are no needles, it's just cold air and this like high pressured kind of system that delivers the PRP. And I didn't really think it was going to work because I read their initial studies and the depth of penetration was about like 1.8 millimeters. So I'm like, well, the bulbs are going to be deeper than that, closer to 4 millimeters. I'm like, is it really going to penetrate enough? And then at the virtual ISHRS conference just, recently, it was really interesting because there were a couple of people, like senior people in the field, talking about it. When they do their injections for PRP, they started using more superficial injections like into the dermis, with the thought that maybe it's now diffusing down as opposed to deeper injections into the scalp. And I thought that was super interesting because I'm like, well, I mean, I'm telling you, the study, like, it looks like the results are very solid, and hopefully it'll be published soon. But I'm like, it was so much more superficial than the bulb, but it kind of
So
worked,
you're not abrading the scalp at all? You're not using a dermal roller or anything to prepare scalp?
No, it's transdermal infusion of well, anything you put in it. So in this case, it's the person's PRP, and it's usually 5 cc's. So it's an M-Site 60 cc kit, super concentrated. So I just take 5 cc's of plasma, and the rest of the all the platelets are just in that 5 cc. Because it takes some time to distribute all of that, and you can cover, the main part of the scalp with just 5 cc's. Whereas if I'm doing injectable PRP, I'm using usually closer to about 12 to 14 cc's to kind of deliver it. So
well, we'll talk more. I like to get more information on that. But I've been approached, and we actually had a company called True Dose on the Global Hair Loss Summit, and they created an algorithm and kind of a protocol where people can actually kind of gauge a more accurate dose of PRP for each particular patient. I don't know if you know anything about that, but
no, I don't.
We're going to be presenting that a little bit more through the Global Hair Loss Summit and the Bald Truth. It's something that I think I might love to see physicians get their hands on, because at the very least, everyone's going to be able to input their protocol, input their dose, so that we can have a more, it would be put into the algorithm where eventually people will be able to figure out, or doctors, exactly what dose works for what type of hair loss.
Interesting.
Consistently. I think that's pretty exciting stuff.
Yeah, that is, and the more like knowledge sharing that we do as a community, the better everyone is. So that's great. Yeah, I definitely love to hear more about it.
Doc, we could talk forever. My phone is dying.
That's good.
Yeah.
All right. Thanks so much for joining me. Really appreciate it. It's kind of eye-opening experience for me. And just appreciate your time. I know you're a busy guy, so thank you very much.
Well, no, I appreciate the invite, and I'm sure that we'll be speaking again soon. And good luck with everything.
Thank you so much.
Okay.
Best.
Right. Take care.
Bye.
I will. Bye-bye.